In this video we're going to learn about type 1 and type 2 diabetes. We need to know the types of people who are most likely to suffer from type 1 and type 2 diabetes and the course of the disease, exactly what the effects on the body are. Diabetes is when there is a failure to control blood glucose level and an impaired ability to store glucose in the form of glycogen. There's nearly 250,000 people in Scotland who suffer from diabetes. This has been increasing, mainly due to type 2 diabetes rather than type 1. The numbers of people with type 1 diabetes stays relatively constant. Type 1 diabetes normally occurs in childhood. People who have type 1 diabetes are unable to produce insulin. This means that they are unable to lower their blood glucose levels, and their blood glucose levels remain very high. In order to understand how diabetes works, we need to know how glucose enters cells. Glucose enters cells through membrane proteins, by diffusion. These membrane proteins open when insulin binds to insulin receptors on the cells. This diagram shows what happens. Insulin is a hormone that binds to a specific insulin receptor on a cell membrane. When insulin binds to the insulin receptor, this causes the glucose protein channel to open and glucose can enter the cell through the channel. So insulin tells your body cells to absorb glucose so that the cells can then use the glucose for aerobic respiration to produce energy. People who have type 1 diabetes do not produce insulin. Therefore, nothing binds to the insulin receptors on the cells, and the glucose channels remain closed. This means that glucose will remain in the blood. The treatment for type 1 diabetes is regular injections of insulin. Before injecting insulin, a type 1 diabetic must check their blood glucose levels to make sure that they are injecting the correct quantity of insulin. And they do this by pricking their finger to get a little bit of blood, and they have a special blood glucose meter that measures their blood glucose levels. Type 2 diabetes usually develops later in life. People who are overweight have an increased likelihood of developing type 2 diabetes. In type 2 diabetes, individuals can still produce insulin, but their cells are less sensitive to it. And this is referred to as insulin resistance, because the body still produces insulin, but the insulin does not have any effect on the cells. The insulin receptors with type 2 diabetes have become inflamed or damaged, and this means that they are unable to bind with insulin. As a result, the cell membrane proteins that transport glucose remain closed, and glucose accumulates in the blood. Insulin resistance is also linked to a decrease in the number of insulin receptors in the liver. This leads to a failure to convert glucose to glycogen, which also contributes to high blood glucose levels. So, healthy insulin receptors on the cells will allow insulin to bind. This then opens the glucose channels to allow glucose to pass into the cells. In type 1 diabetes, no insulin is produced, so the insulin receptors are not activated and the glucose channels don't open. The glucose then remains in the blood. With type 2 diabetes, the insulin receptors have become damaged. That means insulin is produced, however it is unable to bind to the damaged receptors. So the glucose channels are not activated and glucose cannot enter the cells. So the cells are failing to respond to the insulin. Type 2 diabetes can be treated using lifestyle changes. For example, reducing the amount of fat and sugar in the diet, exercising regularly, and losing weight if necessary. If lifestyle changes don't work, then medications which lower the blood glucose levels can be given. With both types of diabetes, blood glucose levels will rise rapidly after a meal. The kidneys will remove some of this glucose, and this means that glucose will appear in urine. Testing urine for glucose is often an indicator of diabetes. The glucose tolerance test is used to diagnose diabetes. The person first of all has to fast, and then blood glucose levels are measured. The individual then has to drink a glucose solution, and changes in their blood glucose concentration are measured for at least the next 2 hours. This graph shows the difference between a diabetic person and a healthy person with a glucose tolerance test. So you can see with the healthy person, once they have ingested glucose, their blood glucose levels initially rise, and they peak about an hour, and then after about an hour they begin to fall, and they eventually return to normal. With the diabetic person, can see that the blood glucose levels rise. They rise very rapidly, and then they do begin to fall again as the kidneys remove some of the glucose and the cells use some of it for respiration. But the key thing here is that the glucose levels in the diabetic do not return to normal. So a diabetic person will normally have a higher initial blood glucose level than a non-diabetic. The blood glucose level will rise much higher than a non-diabetic, and it will not return to normal. People with diabetes need to take care to carefully control their blood glucose levels. If blood glucose levels are not controlled, it can cause damage to blood vessels, particularly those in the eyes and the kidneys.